Hi everyone, welcome back. So, some of you may have seen my previous posts about PTSD. I did a video on how massage can help those with PTSD in terms of easing the symptoms. And I've also just recently put one up on the relationship between PTSD and skin conditions. So I'm going to do, it's just going to be a short video today on the relationship between chronic pain and PTSD. We know that the impact of living with chronic pain, can be, life-changing under normal circumstances, where, bringing in inability to do your work or even to do basic daily activities. But, chronic pain also impacts greatly on mental health, with sufferers feeling unable to cope and feeling quite often like they're being judged, for their limitations. Now, research has shown that pain is one of the most common physical symptoms of PTSD, with an estimated 20 to 30% having frequent pain and a high incidence of pain-related disability. Chronic pain, when experienced alongside PTSD, has certainly been shown to be more severe and coincide with depression and a higher rate of substance abuse, whether that be, painkillers or alcohol or whatever. So why does PTSD actually cause physical pain? Well, you'll know if you've watched my previous video on how massage can help with PTSD, I talk about the physical symptoms and the physiology behind PTSD. Certainly that sort of hyper-arousal symptoms of PTSD can often induce, when you're permanently on edge, that can often induce tense muscle pain, which may become chronic. Anxiety and hypervigilance generally increase the tension in muscles and on the joints. And this can even occur when the person is asleep and sort of technically has not that they have really any control anyway, but when they're unaware of even what they're doing, they can still be tensing their muscles. Also, long-term increased cortisol levels, which is your stress hormone. In PTSD, you are pretty much stuck in that fight or flight response, where the adrenaline just kind of keeps going round in a cycle because it has nowhere to go. And this can deplete the adrenal glands, which will then increase the level of a hormone called prolactin, which will cause a rise in pain sensitivity. So obviously you've got the increased muscle tension, due to the hypervigilance, and then you're going to feel that tension and feel that pain more due to these hormone levels. Also, many PTSD sufferers demonstrate a reduced ability to go outside and to exercise, which again may lead to muscle pains. Potentially, this can become a chronic issue. And also traumatic events, can cause serious physical injuries, which again will lead to chronic pain. So it could be something, from that initial trauma, that is causing ongoing pain. And certainly for those sufferers who maybe have acquired PTSD through military service, this would certainly be, a contributing factor in a lot of cases. So how do we treat chronic pain with PTSD? Accessing treatment for PTSD or chronic pain, just accessing treatment for either one of those issues can really impact on your self-esteem, and can be difficult, to access that treatment. But, both of those things together can feel completely overwhelming. But, although you may be tempted to just maybe treat one issue at a time because of this, that's actually likely, to be counterproductive, because you can treat one, but then the other problem will still be there. So it will still be causing those problems that you've treated. So treating them as a mutually, related problem is advised. And this is another reason why massage can be so effective in these situations, because it treats both the physiological and the psychological aspects of PTSD, as well as dealing with the muscle tension and the chronic pain. Now, EMDR and CBT certainly have a place, in the treatment of PTSD, but they won't address, the physiological problems. They will really only focus on the psychological aspect of it. So, if you've not already, looked at my previous video on how massage can help with PTSD, and you think this may apply to you, I would really suggest watching that, and it will explain why PTSD happens, all the physiology behind it, and why you get those physical symptoms. And hopefully this will give you a better understanding of, which way to sort of go forward in terms of treatment for you. So that has been a brief video, but hopefully it has given you some understanding of why, you may be experiencing chronic pain if you are already, a PTSD sufferer. But any questions, do feel free to comment down below, or you can message me through my Facebook or Instagram, and I will do my best to answer you. I have a very good understanding of PTSD because I've suffered with it myself for over 10 years now. Feel free to contact me. But for now, that is all from me. So I will see you next time. Take care. Bye.